Welcome to another webinar of Type 1 Diabetes by Phablecare. Hope you guys are all doing well and are safe. So, all of you must have heard about diabetes. When we talk about diabetes, we talk about sugar. We talk about sugar, we talk about type 2. But do you know there is a diabetes which is known as type 1 also? Normally, if you know that everyone, when we talk about diabetes, it is like they say, okay, sugar hai aapko. शुगर है, बीपी है, कौन सा शुगर है आपको? तो किसी को ये नहीं लगता, कोई ये नहीं बोलता टाइप 2 है कि टाइप 1 है, बस शुगर ही बोलते हैं हम लोग, राइट? But there is a type of diabetes which is known as type 1. According to International Diabetes Federation, that is IDF, 2.3 lakh children and young adults are having type 1 diabetes. And this number actually only constitutes around about 5 to 10% of the total diabetics. Surprising, right now? Yes. So today we'll be talking about this form of diabetes. And with us, we have our esteemed speakers. One is Dr. Madhura, Karguppikar. She is a pediatric and adolescent endocrinologist who's based out of Pune. She has an expertise in managing children and young adults with type 1 diabetes and has handled over 500 cases and has over 16 research publications with specializing in kidney problems in children with type 1 diabetes, children and young adults. Also with us, we have Mr. Sahil Madan, who is a fitness trainer. Actually, he is India's first fitness trainer for type 1 diabetes. He himself is a type 1 diabetic since 2011, and Sahil has dedicated his life actually to improvising people with type 1 diabetes from handling fitness. How do you manage type 1 diabetes? By being fit. Now, Sahil has conceptualized and founded Fuse Training, which is India's first type 1 diabetes health management startup. Now, Fuse Training is a part of Phablecare presently. So we'll start the webinar with our two esteemed speakers. And Dr. Madhura, welcome. Sahil, welcome.
Thank you very much, Preeti, Dr. Preeti, for the very kind introduction. I'm very excited to be a part of this webinar. I hope it helps.
Sure.
Hi, Dr. Preeti. Hi, Dr. Madhura.
Hi, Sahil. So for our users, please, we'll be starting the webinar right now, and whatever questions you have, we'll be able to address it at the end of the session. Please note your questions, and we'll try to address as many as possible. But we'll address all, but maybe on the webinar, we might not be able to address everything, but we will definitely get back to you through email or through our representatives, right? So, okay, Dr. Madhura, the first question I want to ask you is actually, let's go back to our basics. Before going into deep diving into type 1, let's first understand what is diabetes and what are the different types of diabetes.
I think, yeah, that's a great question to start with. So diabetes is a blanket term used for all blood sugars being high. So if your blood sugar is high, you have diabetes. Now, the cause of that high blood sugar remains to be decided by the expert, and then you come to know whether you have the type 1 diabetes, type 2 diabetes. There are many other types of diabetes, but then today we will talk only of type 1 and type 2. To give you a brief introduction, I think, about type 1 and type 2, of course, we will go deeper into it. But type 1 is a type of diabetes in which your pancreas, which has specific beta cells which produce insulin, stop making that insulin. Whereas in type 2 diabetes, pancreas make insulin, but your body cannot make use of that insulin. So one is an insulin deficient state. Insulin hota hi nahi hai. Second, type 2 diabetes, you have insulin, but your body doesn't know how to use it. That's the basic difference.
Very, very nicely explained ki haan, insulin hi nahi hoga, to fir the main problem starts there.
Right.
Now let's deep dive again into the main topic, which is known as type 1. So what is exactly type 1? You have explained, but would you want to explain to our users a little bit more about type 1 diabetes, that how common it is, right, and which age group does it affect more?
Right. So basically type 1 diabetes, if you ask how common it is in comparison to type 2, you can call it rare also, because per household, when you go, some, grandfather, grandmother, somebody is always having type 2 diabetes. But type 1, most of us, it's unheard of. So type 1, on an approximation, you can say 10 in every 1 lakh are affected with type 1, which is quite a rare thing. And are only children and adolescents affected by it? No. Even the adults are. The presentation is earlier in life. So children and adolescents usually present and then they carry on with type 1 through life. So that's about the age of presentation.
Right. Sahil, you have been a part of this community for a long time. So, how many, if I would ask you, so how many children approximately, like if I ask you in percentage, कि कितने बच्चे और कितने young adults, बच्चे ज़्यादा थे कि young adults ज़्यादा थे who are affected by type 1?
Right. The people I have met in the last 4 or 5 years in India, I would have seen, I think, 30 to 40% of kids living with type 1, and the rest, teenagers, young adults getting diagnosed with type 1.
Right, right. Understood. So that means if I would take it as it will be equal, or or you are saying that it will be more in kids.
If you say, yeah, we can divide by, 18 plus, then it would be kind of similar only.
Right. So have you seen cases where it's like a 3-month-old baby or a 4-month infant, I would say, is affected by type 1?
Yes,
the
I
young
have.
Dr. Madhura, you also can answer this. Yeah, yeah. Yeah, it is your question. Sorry. I think Dr. Madhura, you are the right person to ask this
Right.
question.
The youngest I have seen is 12 days old.
Oh, seriously?
So even a baby as young as 12 days, it depends on, you're born with a predisposition to have diabetes. So the minute you're taken birth, at some point you will have diabetes. That is destined for you. When you present is, nature's and your body's call.
Yes, thank you so much to know. It's very, very sad to hear that. Yeah, it's like,
I know.
but then, yeah, at least we should be aware of key. If I'm just reiterating your words, that type 1 diabetes can occur from 0 day of birth.
Absolutely. Absolutely.
Understood. So now let's come to what will be the causes and the risk factors for any individual. For that is individual, I'll call it children and young adults. I'm addressing them as individuals. So what will be the causes and risk factors for a person to develop type 1 diabetes?
Right. So type 1 diabetes in medical terminology is an autoimmune condition. Now, let me just explain to you with an example what it means. So for example, I get COVID. Okay. Now the body identifies that the coronavirus is foreign. It's not a part of my body and wants to kill it, wants to get rid of it, right? So it makes antibodies against the coronavirus and gets rid of it. Now, in individuals who are born with this autoimmunity, they don't identify pancreas as their own. Pancreas is the organ which makes insulin. तो बॉडी को पता ही नहीं है कि pancreas अपना एक पार्ट है. So body starts identifying it as foreign, उसके against antibodies बनाता है and gets rid of pancreas. So these individuals don't have insulin. So that's the whole pathophysiology, or how that person develops type 1 diabetes. Now, what are the risk factors? You're born with it. There is no way you can avoid its occurrence. There is no way of preventing it, unlike type 2. Like now, if my parents have type 2, I will be prepared since a younger age, saying that, okay, I have to have a better lifestyle and I can avoid the occurrence of type 2 sooner in my life, right? I can push it as much as possible. But in type 1, there's nothing like that. It will present when it has to. You cannot prevent it.
Understood. Now, actually, you've answered my next question, which I had, and I think a lot of our users have that question is, if I tell you that, let us have some, if you could enlighten us by telling, how do we differentiate type 1 and type 2? Normally, you must have seen people don't even, we are talking about type 1 because we know that there's around a 5 to 10% community who are affected by type 1 diabetes. But for them, that 5 to 10% people, they want to know exactly and not them only, I think people with type 2, they want to understand also what is the difference between a type 1 and a type 2, very like around 5 points. It happens in type 1, this happens. You have answered part of my question before about type 1 and type 2.
But I think that's a very relevant question. And that is one thing we must all be aware of. So type 1s usually are losing weight, right? Whereas type 2s are on the heavier side. Next thing is that type 1 diabetes presents with, as I said, weight loss. There is, increased thirst. The child or the young adult is, visiting the washroom a lot of times to pass urine. This is the presentation of type 1 diabetes. Whereas in type 2 diabetes, they are on the heavier side. They are, they have darkness in the nape of the neck or in the underarms, they have darkness there. You might have noticed a lot of people around you who are, prone to this in the future. They would start off like this. Now, the important bit here is the management. How do you manage type 1 and how do you manage type 2? Both have very different management. Type 1, insulin is the only answer. There is no other, wonder drug that can cure type 1 diabetes. Whereas type 2, your lifestyle changes, your diet, your exercise, then there are oral medicines which can help type 2 management. So that's the contrast between type 1 and type 2.
Yes, Dr. Madhura, thank you. We'll be touching on these management also a little later in the webinar. We'll be going into depth of each one of them.
Dr.
So
Preeti,
now,
can I add a point here to what Dr. Madhura said as well?
yes, please, Sahil.
As Dr. Madhura said, that type 1s are usually, not on the heavier side, but also underweight. So what from my experience I could see is, so I was diagnosed at the age of 20. And before that, I was never able to put on much weight. So that was always a struggle for me. Of course, I didn't knew that, this might, I might have, less insulin production or, some other chronic disease coming up at 20. So it is quite relatable to when I hear it now.
Yes, Sahil, a very good insight. I understand. Yeah, when you are a kid and then you are trying to eat and then you say, obviously mothers will say, "Arey, mera bachcha itna dubla kyun reh gaya, bichara, khila do usko, khila do."
Right.
But the parents also are not aware that it's not about the child not eating well. It is about the condition they have.
In fact, they do eat a lot.
Right.
In spite of that, they don't gain weight. So I think that is a red flag which all of us must remember.
Yes, thank you so much, Sahil and Dr. Madhura. Yes, also I would like to ask Dr. Madhura, now when we know about the causes, the risk factors, and about type 1 initially, that exactly what it is, let's come down to signs and symptoms. So what are the signs and symptoms and the red flags, as you mentioned,
Right.
that one should look out in type 1 diabetic, if you're a type 1 diabetic?
Yeah. So initially, you don't know, obviously, that you have type 1 diabetes. So the symptoms are pretty vague. Like I said, I would like to mention again, the child or the young adult is losing weight, eating a lot, in spite of that losing weight, drinking a lot of water. You will notice, the family members clearly say that, yes, this one drinks a lot of water, visits the loo way too often to pass urine. Some children also present with blurring of vision. It's a rare presentation, but sometimes they say that, okay, I can't see properly. So high sugars can do that to you. Then they are more prone to fungal infections. So this could be in the oral mucosa, I mean in the mouth, it could be around the genitals, they could have fungal infections. So these are all the lookout signs for type 1 diabetes.
Yes. So if I'm right, just correct me. When I say the signs for type 1 and type 2 are more or less similar, like polyphagia, polydipsia,
Yes.
polyuria, I'm talking medically. So if I
Yes.
say that increased thirst and increased appetite, so that remains same. But the remaining signs for specific for children, anything else is there except when you
The
said
weight loss. The weight loss is very typical of type 1. That never happens in type 2. In type 2, they're gaining weight. In type 1, they're losing weight.
Understood. Thank you, Dr. Madhura. Now we have seen also that in type 1 diabetes, as we know, it occurs in children and young adults and adolescents. Now, these people usually, parents will not want no one is aware to that extent that no one wants their child to get a blood glucose tested.
Right.
Because that's the last thing on their mind, that they say, glucose
Absolutely.
बच्चों में टेस्ट क्या कराएंगे हम जबरदस्ती.
Correct.
तो how उन लोग में डायग्नोज कैसे करते हैं हम, एंड डॉक्टर कब कंसल्ट करना चाहिए, कौन सा, मतलब एनी टाइम दैट इफ यू कैन प्रोवाइड एन इनसाइट की सेइंग कि ऐसा करना चाहिए और डॉक्टर को कंसल्ट उसी टाइम करना चाहिए, या तो पेरेंट्स को कुछ बताना है हमारी तरफ से इस वेबिनार के कि ओके दिस आर द थिंग्स वी शुड डू?
I think that's a very important question. So like I said, these symptoms, of course, we have to look out for. That, if your child is losing weight, बच्चा बार-बार आके घर पे बोल रहा है कि मम्मी मैं थक गया हूँ. At the end of the day, usually children or young adults are energetic creatures. They are not tired at the end of the day. But if the child comes back and says, "Mummy, मैं बहुत थक गया हूँ," in spite of doing the routine work also, they're very tired, drowsy child. Think of type 1. There's no harm in getting just a sugar checked. It's not going to do any harm, right? At the most, you'll have a normal blood sugar, which is great to know. But look out for these signs and symptoms. Then, unfortunate event. It also is seen that these children, if not picked up sooner, end up in a condition called diabetic ketoacidosis. Now, to simplify it, in diabetic ketoacidosis, the child has trouble breathing, सांस लेने में तकलीफ होती है, and the child is completely dehydrated. You can see that the tongue is dry, the eyes are dry, and needs an ICU admission. So we don't want to reach it until there, but we want to pick it up in the initial signs and symptoms with a very vague. So would want to again say the same thing: your child losing weight, feeling tired, drinking a lot of water, passing urine too often, think of type 1.
Yes, thanks, Dr. Madhura. Sahil, I just want to ask you. Suddenly, I'm sorry. You keep, I'm very inquisitive because you are yourself a type 1 diabetic and you have become a fitness trainer, handling, improving lives of so many people there. So, were there the same symptoms, happen to you also? That is, you experienced those symptoms, or were they a little different from what Dr. Madhura was saying?
So they were exactly same. And when Dr. Madhura was actually giving the inputs of the symptoms and everything, I was getting a flashback in terms of what symptoms were and how my family couldn't recognize it, because they didn't knew that, okay, a 20-year-old, and I was very active. I was not overweight or anything, so that they feel that he's not going out or playing or not doing any physical activity. How can he develop any chronic problem? So they never bothered. Even if I was losing, I remember I lost around 10 kg of weight in 2 months, but we were not aware of that. Okay, something like type 1 diabetes is there. So they didn't take me to check my blood sugar levels. So that's how, because of no awareness, people don't get diagnosed early, and then they end up in DKA, and that is exactly how my diagnosis was.
Yes, it is very, very important right now. I think this webinar is a very eye opener for some patients, some parents actually, whose kids are having type 1 and they do not know it, because I think this webinar will give them insights about when exactly they should, these are the signs and symptoms they should look out for, and if they don't delay it, this condition can be managed pretty well. And we have a live example in front of us who's a fitness trainer and who's handling it right now. So thanks, Dr. Madhura and Sahil. Now, Dr. Madhura, you keep answering my questions beforehand, and I hope I don't run out of some questions here. So I wanted to ask you here, you said there's a complication. What are the complications of type 1 diabetes, which you said DKA, diabetic ketoacidosis, is one of them. What are the other complications that a type 1 diabetic, might have, and when exactly?
Right. I think that's a very valid question, and many people with type 1 diabetes are often quite bothered with this, that in spite of me having done so much effort and work, will I end up with complications early on in life? So yes, there are complications associated with type 1, but what is important for us to remember is how we manage. जब तक आप अपना type 1 diabetes अच्छी तरह से manage करते हैं, जब तक HbA1c is, आपके 3 महीने का, पिछले 3 महीने का शुगर कैसा रहा है, HbA1c is the parameter which tells you that. So on the whole, as far as you maintain your HbA1c less than 7, or in a more practical world, between 7 to 8 is also a fair control. You are pushing your complication years ahead. Now, what are the complications? Complications are mainly seen in kidneys, called as nephropathy in medical terms, seen in the eyes, called as retinopathy, and in the nerves, called as neuropathy. So, ये सब complications हो सकती है with type 1 diabetes, but we can push them a lot ahead as far as you maintain your sugars in range. The sugars जब तक ठीक है, you're going to lead a perfectly normal life like you and me. Sugars not in range, you will start seeing this complication as early as in your 30s. So the key is to maintain your sugars, which is a monumental task. And I would want to mention here that Phable's Diabetes 360 Care program, which is therefore specifically curated for type 1. ये program बना है type 1 के लोगों के लिए, and it is curated by type 1, who is Sahil. So I think it's very important that it's a holistic approach, it's a wholesome approach. Now, मैं अकेले as a doctor, I cannot go to each patient and say कि आप ये कीजिए. It's a holistic and a wholesome program where you need a fitness expert, you need a doctor, you need a dietitian, you need a lifestyle mentor. I think Phable has perfectly put all of these together in one program, and it's available to you. Rather than saying at your doorstep, it's available to you and on your tab or your laptop. You just have to open it, and these people will guide you around it. That's how simple it has made. It has been made for everyone.
Yes, Dr. Madhura. Yes, sure. Yes, we have that Phable. I understand.
Yes.
And yes, you are absolutely right. Just for our viewers, I would like to say when you said HbA1c, it is glycosylated hemoglobin, which measures your glucose over a period of 3 months. So just for them. And also, I have one, in between, I was supposed to ask another question, but then suddenly, you prompted me to, think something. So now, type 1 diabetes में भी हमको डायबिटिक रेटिनोपैथी होती है, न्यूरोपैथी होती है, एंड व्हाट डू यू कॉल दूस नर्व्स का जो न्यूरोपैथी
Neuropathy.
रेटिनोपैथी एंड योर डायबिटिक कीटोएसिडोसिस. How do we, the only thing is diabetic ketoacidosis, if I'm understanding कि type 1 में थोड़ा different होता है. तो how do we differentiate only on the basis of your weight loss and weight gain, or on any other complication except diabetic ketoacidosis कि ये type 1 है? Complication के वाइज में कोई difference है type 1 type 2 में?
No, not really, because ये complications जो होती है, this is not because of type 1 or type 2. ये complications होती है because of high blood sugars. So in any case, type 1 हो या type 2 हो, जब आप अपने blood sugars high होते हैं तो ये complications होती ही है. So the key in both cases is to keep your blood sugars in check.
Sure, Dr. Madhura. Dr. Madhura, you're a practicing doctor. So have you seen in your experience people deteriorating to that level, and why?
Soon, I have seen a 9-year-old child developing diabetic nephropathy or kidney complications because the sugars were never in check. The parents were not cognizant, or perhaps sometimes they want to help, but ho nahi pata hai in the whole, madness of life, or, they are not guided properly. Like I said, it's not only a doctor's job. It's a wholesome care that you need. वो नहीं मिलती है. This child ran very high sugars, and now he is at a point where he might need dialysis every day because his kidneys are not working anymore. So complications are very common when diabetes is not taken care of. One more point I want to make here is, if you have had high blood sugars for say 5 years or 10 years for that matter, वो जो damage हो गया है, that is irreversible. That is the worst part of complications with type 1 or type 2 diabetes. The time lost is time lost. You can only prevent further damage. So keep your sugars in check. Whoever is listening, I mean, it's very, very important.
Yes, absolutely. Actually, people become very, not, they're very, very casual about it. They'll say, क्या फर्क पड़ता है, आज नहीं करेंगे, आज थोड़ा, आज दिवाली है, आज होली है, आज घर में पूजा है, थोड़ा सा 4 दिन बाद हम ब्लड शुगर कर लेंगे, और कौन सा मेरे बच्चे को इतना हुआ है, या तो यंग सा बच्चा है, ठीक हो जाएगा अपने आप. If I'm not wrong, that is the attitude.
That is the attitude, and they don't realize the gravity of it. They are not wrong in saying that. They don't realize, and I think it's your job as a doctor and mine as a doctor to educate them and tell them that, it's serious, take it seriously.
Yes, absolutely, Dr. Madhura. So yes, now that we have understood that what is this condition, what are the causes, what are the symptoms, now let's look exactly how a type 1 diabetes can lead a normal life with the right management. So Sahil, you have been quiet for a long time. So now I'm going to make you a little bit, interacting with our viewers. Now, Sahil, if you can tell me that how is type 1 diabetes treated or managed, and in taking in consideration lifestyle modification. So if I'm talking about management, I would want you to address the lifestyle modification that is required.
Correct. Of course, when you're diagnosed with type 1, we have to be on insulin. There is no alternative to that. But again, managing type 1 requires a lot in terms of your food habits, a lot in terms of your physical activity. And those are actually the, factors that help you in terms of your ability to use the external insulin that you are taking. Everything is managed well if you have right nutrition and you have better food habits, like general habits as well, getting up early on time, just exercising for a bit, leading a healthy active life. These are all the factors that in the end contribute to your type 1 management.
Yes, absolutely. Thanks, Sahil. Now, Dr. Madhura, Sahil has addressed the lifestyle modification. I would request you to address what are the medication that can be used in type 1 diabetes. Now, people think type 1 diabetes, dawai kha ke hum theek kar lete hain. So are they right in thinking that?
No, they are absolutely wrong in thinking that. Type 1 diabetes has no magic drug other than insulin. The cornerstone of diabetes management in type 1 is insulin. There is no other answer to it, no alternative medicine. बहुत बार parents आते हैं. Obviously, parents also are in a desperate situation, or a young adult who's like, say 22, 24, wants to get married, is in a desperate situation जहाँ पे ये हटा दो, मुझे insulin रोज नहीं लेना है. I will try my Ayurveda or homeopathy and I will try to get an answer to this. नहीं हो पाता है. Absolutely wrong in thinking that something else can help. आप जब पैथोफिजियोलॉजी समझेंगे आप खुद समझ जाएंगे कि क्यों इंसुलिन इंपॉर्टेंट है. योर बॉडी इज नॉट मेकिंग इंसुलिन, so the answer is giving insulin externally. So tablets help type 2, not type 1. That's the bottom line.
Yes, that I think we need to reiterate every time, because I have also, as a doctor, experienced this. People asking me कि tablets क्या लेना है type 1 में, type.
Right.
No, so tablet, people have that thing कि type 1 also can be cured by tablets. Yes, so we'll reiterate it that yes, insulin and only insulin is the treatment for type 1 diabetes.
Absolutely.
And what is the correct way, Dr. Madhura, कि आप insulin administer कैसे करते हैं?
Right. Now, I think that's also a great practical question that we should all know about. Insulin is administered with a syringe as thin as your hair. You barely feel it. छोटी सी needle होती है which goes right under your skin. In a baby, you need to pinch the skin like this and give it. But in an adult like you and me, our skins are pretty thick. So you just hold the needle. Syringe में आती है, or it's a very user-friendly pen device also which you can use and carry around. Just hold it straight and give it like that, right under your skin. Now, where to give it? It can be given on your arms, both the sides, upper and outer aspects of your thighs, around your tummy. That's where you can give insulin. That's where the skin is thickest. Right under the skin is where you give insulin.
Yes, thank you, Dr. Madhura. I hope the users have noted this. And Sahil, you must be taking insulin also daily. So if you could throw some light here, कि how many times are type 1 diabetic? It's not a very pleasant thing to have. It's not like a chocolate खा रहे हैं या toffee खा रहे हैं हम आज के दिन में insulin ले रहे हैं. So it is not a very pleasant question to ask, but this is a very important question, because what happens is at least हमारे users पता होगा कितनी बार हमको insulin लेनी चाहिए, या हम decide करेंगे या कोई डॉक्टर डिसाइड करता है ये, और मतलब अगर हम एक दिन भूल गए लेना तो क्या हो सकता है?
To answer your question, I have been taking insulin for last 11 years. I was diagnosed in 2011. So since day one till now, I'm taking insulin. Of course, every parent or every relative, there were a lot of Ayurveda stuff and things tried, but I never stopped insulin. And of course, in the initial years, I didn't knew the pathology of how this all things happen. So that was the reason. But as soon as I realized that, okay, this is what the science is, after that, I never tried also, to try any Ayurveda stuff, or I used to make aware my family as well in terms of, that this is insulin I have to take. There is no cure for type 1 diabetes. So that's how, of course, it started. And in terms of insulin injections per day, I think the dose and other things have to be set by the doctor. But of course, as a T1, because you have to manage it 24/7. So there might be slight modifications that you can do according to your lifestyle. So for example, if the doctor has suggested you to take insulin in your meals, and of course, then the long-acting insulin in the night, then for example, if you are eating some snack in between your lunch and dinner, which is heavy on carbs, then also you might need to add insulin for that. So that depends, of course, in sync with your doctor. You can just tweak it according to your lifestyle. And that is what I have been doing. And that's how I'm managing my condition as well.
Yes, Sahil, thank you so much for the insight. इस बात पे हम ये वाले पॉइंट पे हम दोबारा आएंगे आपके पास, आपको पूछने कुछ मैं थोड़ी देर बाद आऊंगी. बट इस वक्त डॉक्टर मधुरा से मेरा एक क्वेश्चन है कि आप इंसुलिन कैलकुलेट कैसे करते हैं? हाउ डू वी कैलकुलेट इट एक्चुअली, द इंसुलिन डोज, इफ यू कैन एक्सप्लेन टू आवर यूजर्स.
So there are ways of doing it. For somebody who is very new, usually as a doctor, I calculate it according to body weight as a starting point. So for example, if you are 50 kgs, you are going to need approximately 50 units of insulin in the day. Now it may be in different compositions and different types, but approximately 50 units. So I start like that. And then according to how the sugars are keeping, I either go up or down. Now, as you have a better understanding of type 1, there is a concept of carb counting, where you count the number of carbohydrates in your meal and your blood sugar, put it together, and you calculate your dose of insulin. Your doctor teaches you how to do it, but then you calculate it yourself. Because if your sugar is 150 and you are going to eat only sprouts, you're going to need a lesser dose. अगर मेरा शुगर 250 है और मैं 2 समोसे खाने वाली हूँ, तो मुझे बहुत ज्यादा, काफी ज्यादा इंसुलिन लगने वाला है. So that is the practical way to manage it. So that, of course, when you go further, the doctor or the dietitian teaches you about it.
आप मत बताइए डॉक्टर मधुरा, साहिल को भूख लग रही होगी.
Not a samosa fan, but still yes.
साहिल, आप जरूर समोसे खाइए, इंसुलिन लेके खाइए.
Yes, so on a little lighter note, that was it. And now अगर हमने बात करी है सब इंसुलिन के बारे में, हर एक ड्रग का एक साइड इफेक्ट होता है, एक प्रिकॉशन होता है. तो क्या प्रिकॉशन लेना चाहिए हमें? और सबसे पहले तो हम बात करते हैं साइड इफेक्ट क्या होते हैं. इंसुलिन के भी साइड इफेक्ट होंगे, जो ड्रग आपको बचा रहा है उसके भी साइड इफेक्ट हैं, होते हैं.
वैलिड क्वेश्चन, बिकॉज बहुत बार पेरेंट्स आके पूछते हैं कि आप तो बोल रहे हैं कि ये लाइफ लॉन्ग लेना है, लेकिन साइड इफेक्ट्स होंगे मेरे बच्चे के लिए इसके कुछ. So yeah, so insulin is a very life-saving hormone which is made by your pancreas. Since your pancreas is not making it, we are only substituting it. So insulin per se has no side effects. अगर हम इंसुलिन बार बार एक ही जगह पे देते रहेंगे, so suppose I identify my left arm as my favorite spot to give insulin, और वहीं पे मैं देती रहूं इंसुलिन बार बार, तो then the skin there and the subcutaneous tissue जहाँ पे इंसुलिन हम देते हैं, that becomes insensitive. That is a condition called lipoatrophy or hypertrophy. There are 2 types in it. तो वो हो जाता है, वहां से ना इंसुलिन एब्जॉर्ब होता है, ना वहां पे पेन होता है. तो यूजुअली द यंग एडल्ट देन सेज कि अच्छा यहाँ पे पेन नहीं होता है, मैं यहीं पे ले लेता हूँ इंसुलिन. तो दैट इज द रॉन्ग. हाउ टू प्रिवेंट इट? Prevention is by rotation of sites. So what I usually tell my little children, who are patients with me, is that breakfast का इंसुलिन हमेशा हाथ पे ले लो, lunch ka insulin always on the tummy, dinner insulin always on the thighs. So that's how you rotate your sides. Jab tak you do this, store your insulin properly, give it properly, there are no side effects.
I know, being a pediatrician, you must be encountering a lot of, the word is not right, encountering, you must be addressing a lot of children. And अच्छा लगता होगा उनसे बात करना, but the minute you know, I don't know, I'm just asking you off the beat, the minute you talk to them and they have type 1, the first feeling comes, oh my God, इनको कैसे समझाएं? Is it usually it happens that way?
It's the other way around actually, Dr. Preeti. Okay. What you say is right, and initially I used to feel that way. But type 1s are an amazingly energetic race who will come and teach you things you did not know. So I think I have learned so much from my patients, and just the drive, कि मुझे ये करना है. A child taking 4 insulin injections per day, I don't think you and I can do that. So I think it's amazing, and if taught in the right way, they teach us a lot more than we can teach them.
Wow, a very good insight, because I was thinking it will be very difficult to convince a child to take insulin rather than the child is okay कि okay fine, मुझे पता है मेरे disease के बारे में, मेरे को लेना है, मेरे को ठीक होना है.
Absolutely, they have that drive.
साहिल, आप भी ऐसे ही थे बचपन, मतलब 20 years. No, still you are young. I am not saying you are old, okay? So did you have this apprehension when you visited a doctor at your?
Not really, because when I was diagnosed, so I had known only this option to survive. That okay, if you want to live type 1 diabetes with type 1 diabetes, so you have to take insulin. And I never really checked on whether I can stop insulin or take oral medications. So that was not, for me personally, that was not the problem. But I have seen kids or even young adults or 30 plus people skipping their insulin. Reasons might be very different for everyone, but people are still, even after knowing that this is the only way to survive, they are still not taking insulin a lot of times.
Wow, what a different insight. Actually, my whole perception changed about adults and kids. I think kids are more intelligent.
Oh, they are.
I think they are very smart. And, when they get this kind of responsibility very early in their life, and they see the, how their parents are reacting to this or their family, so they learn things.
They mature way too fast, than a regular child.
Right. So coming back to our questions, we had a nice discussion on insulin and kids. So coming back right to the question, ki what exactly, Sahil, this is for you. What is the role of a diet and what is the right type of a diet in a type 1 diabetic?
So again, I have always been, suggesting this, that also I'm not a dietitian, so I cannot say you eat this or you eat that. But in terms of diet, there is no specific diet for diabetes. So I have read where people have written diabetic diet or type 1 diabetes diet. There is no diet like that. It is majorly when you are eating certain number of carbs, protein or fat, you have to eat them according to your body composition. And then when you are actually changing it, so one day if you are eating rice or one day you are eating chapati, you have to understand how that is impacting your body goals, your body composition, and also adjusting insulin accordingly. There is no specific diet. Apple works in the same way for you and me. It won't change. The food functionality doesn't changes with, according to the people who are eating it. So अगर एक type 1 खा रहा है apple को, or if anyone else is eating it, it remains an apple only. So nutrition values remain same. We have to see how insulin is actually adjusted and what we have to eat according to our body composition or body goals.
Understood. And how does exercise help in type 1 diabetic, Sahil? You are a fitness trainer. So if you can throw some light on, how did the exercise help you or your people and what exactly exercise does in a type 1 diabetic?
Also the same perspective that exercise is important for everyone. If you are running, then it will have the same effect whether you live with type 1 diabetes, whether you not live with type 1 diabetes or any other medical condition. The effect of the exercise is same. But because with type 1 diabetes, insulin is not present in our body, then when you perform any different type of exercises, they have different effect on our blood sugar levels. So for example, if you go for running, that will have a different effect. Usually when you go for a aerobic exercise, that is, low intensity exercise, that will tend to drop your blood sugar levels. This there might be exceptions when your sugars are already high and then you are doing the exercise, then it might spike up as well. And specifically when you do high intensity training, for example, you are lifting heavy weights, so that tend to spike your blood sugar levels. So again, this is a very big myth in terms of exercise with type 1 diabetes, that exercise will only drop your blood sugar levels. It's completely wrong. It can also spike your blood sugar levels. It depends on the type of exercise you are doing.
Understood. So that means you should do exercise according, first of all, as suggested by a fitness trainer or a doctor, and do them in a moderate amount as asked. Please do not do it by yourself. Just to users, we are saying that. So am I right in saying that, Dr. Madhura and Sahil?
I think so, yes, definitely. Because, like, I would just say it again what I said, that type 1 diabetes, one person can't manage it for you. There are many things to it. Like, now, for example, if you ask me about fitness training, I would point my finger at Sahil. I would say, please ask Sahil, he knows better than me. Or if you ask Sahil about insulins, though he is type 1, he would say, okay, these are the insulins I'm using. But ask Dr. Madhura. She will tell you better. A dietitian will tell you better about the diet plan. All this put together helps you put your sugars in check. And I think that's what Sahil has, tried to put them all together in a little program called Care 360. And Phable presents it as a package for you so that you don't have to go running door to door, that aap diet ke bare mein bataiye, aap insulin ke bare mein bataiye. Everybody is telling you and everybody knows each other here. So we are on the same page.
This was actually the practical problem I personally faced in the last 11 years. So when I have to consult a doctor, I have to particularly go to an endo, then I didn't have any option for exercise or for diet or for managing stress or burnout with diabetes. So that was my my intention, to get a combined approach of all these experts who can actually help the user to manage their condition in a better way.
Thank you. Thank you a lot, Sahil and Dr. Madhura. Dr. Madhura, I have a question here. कि suppose आपने बोला कि बच्चे बहुत intelligent हैं, अपने आप समझ लेते हैं, but we have when a kid, बच्चा अपने आप तो कुछ कर नहीं सकता, parents ही सब कुछ करते हैं, तो we can call them as caregivers or parents, if I say. So how do you think that, how does a caregiver cope up with this condition? Not the patient itself, himself or herself. How does a caregiver cope up with this condition? some pointers do you have that for them, that if your child has diabetes or if your near and dear one has diabetes and you're a caregiver, some special things we should tell them?
I think it's a tough job. Having type 1 itself is a tough job, but being a caregiver or a family member of type 1 is a tougher job, I believe. So the pointers I would want to say in a one sentence is that type 1 diabetes is not a condition that affects the person only. It's a condition that affects the family as a whole. And we as a family need to change that lifestyle. आप ऐसे नहीं कि मैं बहुत सारी बिरयानी बना ली रात को और बच्चे को बोल दो कि नहीं बेटा तुम तो स्प्राउट्स खाओ हम खाएंगे बिरयानी. That's not fair. So we need to as a family change that. Everything can be done in moderation. That doesn't mean you never eat a laddu or never eat a burger in your life. That's not fair. That also can be done. It needs to be in moderation. Ask your experts how you can go about it. Ask questions. I think the more number of questions you ask, the more answers you get and the easier your life becomes.
Dr. Madhura, आप खाने की बात कर रही हैं. Now I think I have also become hungry with Sahil. Sahil तो बिल्कुल he's smiling all, yes, food is there.
Already imagining what to eat.
Yes, see? Okay.
Dinner is close. Yeah.
So there's actually, what question I was going to ask you both actually right now about it. There's one reviewer and person who is logged in. His name is Kushar. He's been asking, but it's a very important question also about mental health in a type 1 diabetic. So I would want both of you to answer. Anyone can start first and the second person can answer, but I would like to know your both views on what are some of the mental health issues that a type 1 diabetic faces?
For a type 1, again, because it is diagnosed when, in kids, in teenagers, in young adults, it's very difficult to accept the condition that, okay, you have to take insulin for all your life. You have to manage, you can't go out with your friends, or there are a lot of restrictions. So accepting that is very difficult for kids or even young adults as well. And then managing and changing the lifestyle around it, not just yours, but your family is equally involved in that. It is, it creates so much effort that you have to do 24/7. So there is no break. And when you put efforts 24/7, 365 a days, in a year, you will tend to burn out, right? You need breaks at work, at, all the other places. So again, because we don't get any break, and the second part which adds here is a lot of stigma attached to it. So there is no awareness. So that's why there is a lot of stigma, and it creates the pressure on the T1. Apart from the medical pressure that they have to manage, there are a lot of misconception, myths from the society that creates a lot of pressure. And then, of course, when you try to share it with someone else, they can't relate to it 100%. Even if that is my parents or my siblings or my close friends, they cannot 100% relate to it because they are not experienced it. So when we meet, another T1, it's kind of like, okay, two best friends are meeting. So it's that comforting to share with other T1s. And that's how, mental health is impacted. The people I have counseled in the last 3-4 years, I have seen 70 to 80% people's mental health being affected in some other way. Yeah,
Dr.
Dr. Madhura.
Madhura, your views on this?
Yeah, so I think you have almost like put it together in a nutshell, but yeah, you're right. And it's not only the type 1, the individual who kind of faces a burnout, it's also the family as a whole.
Right.
It's very stressful. I mean, you want to just plan a picnic outside, collect your insulin pens, collect your glucometer, put everything together. Bachche ne zyada khel liya, sugar down. He eats an ice cream, sugar up. So it's a lot of work that goes on in the background.
Right.
So for us, what is important, I mean, when we are on the other side of the table, we need to tell them that this can be managed and we are very much with you. So you need to tell them that and, kind of share that responsibility somewhere, because of course, you can't sit at home with them and administer insulin, but this is the least that we can do to make it better.
Yes, absolutely. And I think this is very, very important for the user to understand that also, who are watching this webinar. Now, actually, now we have come to the end of the session of our questions, and now there'll be Q&As, which I have come up with lot of people. So let's address one by one, and any one of you can pick that up. It's not specifically directed to Sahil or Dr. Madhura, but with your speciality, Let me ask Dr. Madhura, if you would like to take from Rohit Singh, there's a question that is type 1 diabetic a genetic condition?
I think that's an excellent condition. I would definitely want to answer this. Yes, type 1 diabetes, you are born with the susceptibility. जब आप पैदा होते हैं तभी डिसाइडेड होता है कि आप at some age type 1 diabetes you will present with it. But at what age is very difficult to say, right? Now, the corollary to that question is that if I am type 1, will my child have type 1? Right? It's a very important question, people who are planning for families. So if you are a lady with type 1, your child having type 1, the risk is only 3%. If you are a man with type 1, the risk of your child having type 1 is 6%. If you have one child with type 1, the sibling, I mean, the second child developing type 1 is 9% risk. And if two type 1s get married to each other, the chance of them having a child with type 1 becomes 25%.
Oh my God. Wow. Matlab, it's not wow, actually, I would say. It is like,
No,
but
but
yeah,
yeah, it's important to know. Yeah.
the statistics is wow for me.
Yeah, yeah.
And I would say that, yeah, so that means, just to put it on a very aerial view, it's like if a type 1 should not marry a type 1.
Yeah. But then,
In
of
short.
course, when you're saying 25, there's a 75% chance that he won't have type 1.
Yeah, but the probability of 25, because 25% is also very high.
But individually, it's only 3 to 10% on the whole. I mean, so it's not a very big this thing. So type 1 is genetic, but in a very small portion. You will see a lot of families who say, who come with a child with type 1 and say later on that, हमारे family में किसी को भी diabetes नहीं है, तो बच्चे को कैसे हो गया? So yeah, it is not genetically inherited always. Most of the times, you just like are born with that predisposition. So it's not entirely genetic.
Dr. Preeti, again, I have a different perspective on this from a patient as well living with type 1 diabetes. A lot of people in the community I know married, like both are T1s and they are married, and their kids haven't developed type 1 diabetes. So of course there is a higher probability that they might develop, but again, my parents or in my family, no one had these kind of conditions, but still I developed. So, and I have now in the last 2-3 years seen that, T1 getting married to a T1. So it's not really that rare as well.
Oh, that's again an insight. Okay. Yeah, obviously Dr. Madhura said 75%
Yes.
chances are there, that so maybe those people fell in 75%. Yes. So Dr. Madhura, you have answered half of Sonal's question. Sonal has asked a question that does type 1 diabetic affect pregnancy or a child of a person who's suffering from type 1 diabetes? So I think you started that question and we went to that genetic part of it. So if you would be kind enough to answer this for Sonal.
Yeah, so there's a tiny bit chance. I would just repeat what I said. If you're a lady, I mean, since Sonal, you are a lady, so the chance of you giving it to your child becomes around 3 to 4%, not more than that. For men, it's slightly higher, about 6% giving it to your child. If you already have a child who is type 1, one child, and you're planning for a next child, the chances go up to 9%.
Yeah, and in continuity to that question, Sonal has also asked, what are the precautions we should take if, we don't pass it to the child? Do you think that anyone can?
Unfortunately, there is no
Oh,
precaution.
yes.
And there is no way you can detect it antenatally. Like there are many conditions when you are carrying the baby in the first 3 months, you know that, okay, this fetus, I mean, the baby can have this condition and you can, abort the fetus. But in type 1, there is no way you can tell. So there's no prenatal testing also that when you're pregnant, you can tell that whether this baby will develop type 1. There's no way to tell.
Okay, fine. So that means we don't have any testing, like when we say that child, we test for neural tube defects, for example.
Exactly.
So we don't have for this.
There's no way for type 1.
Understood. And someone has asked a question of that, are there different qualities of insulin? Do we have to, are there any quality-wise specific criteria for insulin?
Quality-wise, no, really. I don't think so. But there are different types of insulin, yes. So in the younger age group, we prefer a different set of insulins. In the older age group, we prefer a different set of insulins. I'll give you a small example. There is an insulin called Fiasp. So in a baby who's, say, 1 year old, so you can't really predict how much that baby is going to eat. So this insulin we can administer immediately after the child has eaten according to how much he has eaten. Right? That is the specialty of that insulin. Now, if I want to use fiaspin, somebody as old as me, I know मुझे 2 रोटी खानी है तो मैं 2 रोटी ही खाऊंगी. So there is no practical benefit of fiasp over any other insulin for me. So according to age group, according to your type of routine, the doctor writes specific insulins for you. There are many types of insulins available.
Understood. Now, Naveen has asked one question as what is the reason for high blood sugar levels in type 1 diabetes? So high and low, actually hyperglycemia and hypoglycemia के causes क्या होते हैं type 1 में?
So hyperglycemia, as you know, type 1 diabetes में body insulin नहीं बनाती है. Insulin is a very important hormone which allows you to convert the food you eat into useful energy for the body. जब insulin काम नहीं करता है, तो that sugar just keeps lying around in your blood. That gives you a high sugar. वो useful energy में convert नहीं हो पाता है. For which insulin is important, right? So high blood sugar is of course when you eat a lot of not just sweets, even carbohydrates. आप चावल भी ज़्यादा खा लो, don't take your insulin, you have hyperglycemia or high blood sugars. Hypoglycemia is on the flip side. Either you take a lot of insulin and don't eat according to that dose of insulin, you have low blood sugar. Or you exercise way too much. Just Sahil was mentioning some time ago that exercise can also drop sugars. So either you do that, then you get hypoglycemias. Your stress may also give you very high or very low blood sugars. So there are a lot of factors to it. As you understand your body and your diabetes well, you know what gives you what.
Understood. And Sahil, would you like to add something here?
Of course, in this, you are actually seeing, the symptoms also changes for a lot of people in terms of hypoglycemia, hyperglycemia. And for specifically me, when I exercise, different workouts affect in a different way, but then you have to understand also that there are other factors. So you can't really pick out one factor because we are doing 10 activities at once in a day, right? So we are moving as well, we are eating, we are having work stress as well. So that we have to see all the factors and then decide on what exactly it is.
So Dr. Madhura, Rimjim is one of our viewers, and she has asked a question that can we get rid of type 1 diabetes? That is, it will be an answer. I can answer that actually. But then, I would want you to take this question because there's an addition part to it that normally we are seeing nowadays stem cell therapies coming in. And stem cell, till I was aware of it, and it has been curing mostly blood-related disorders. That is more of around 95 to 100 blood-related disorders. We have studies proving that. Now, are there any studies which say that stem cell therapy can cure type 1 diabetes?
I think that's an excellent question. There are a lot of studies underway, a lot of research ongoing for cure of type 1 diabetes. Unfortunately, none have convincing results to say that it can be cured. So there is no permanent cure to type 1 diabetes. In fact, if you go back 100 years, 2022 will be 100 years of insulin introduction. Banting and Best did it exactly 100 years ago. So we celebrate 100 years of insulin. So in these 100 years, science hasn't come up with anything else. Insulin tha, 100 years ago, even today, insulin is the treatment for type 1. There is no other treatment. Having said that, though, there is no cure. You can always have a wonderful life which you can manage around type 1, a normal life. So yes, we can do that.
Yes, agreed. But I think in future, because the way the science is evolving, we all hope that
we really do. Yes,
there should be a cure that at least we can say yes. If it's not cure, it can halt the progression.
Absolutely, absolutely. You can push it further at least.
Yes, true. Now there's one more question which has come, and it is a very common question. I think we didn't address that in detail in our webinar. Is what are the tests which are required for to diagnose type 1 diabetes? And in that, one other question has come from Praveen is, what is a C-peptide test?
So I think, that's a good question. So diabetes as a first step, high sugar diabetes, that's the answer. Now, how to say type 1 or type 2? Now, C-peptide is a test which really helps in kind of differentiating. Not that it always has an answer, but most of the times it does. So C-peptide is a byproduct of insulin. When your body produces insulin, the pancreas also produces a small byproduct, which is called C-peptide, and which can be measured in your blood. So when you measure C-peptide in a patient, if the C-peptide values are below 2, you're kind of convinced it is type 1 diabetes. Above 2 goes more towards type 2 diabetes. Of course, this is not a gold standard test where okay, 2.1, I am definitely type 2. That's not it. There are other tests which can help you, but yeah, this gives a fair idea of what it is.
And Naveen from our viewer has asked, what type of milk or milk products can be given to a type 1 diabetic? So Sahil, would you like to take this question?
I was about to dodge it to Sahil, yeah.
Yes.
So again, it depends. If you don't have any problem with lactose, everything is fine. There is nothing specific in terms of type 1 diabetes in terms of consuming milk or milk products. If your digestion system approves that, specifically for T1, there is no such thing.
तो आप मतलब खा सकते हैं, दूध पी सकते हैं, पनीर खा सकते हैं, but in moderation.
Correct. Of course, that applies on, I think, everyone, not just on type 1s, but on everyone, that they have to do portion control or they have to eat according to their body composition or weight.
So we have some few minutes left and I have some more questions. One is from Kushar, that what about natural supplements which along with insulin, can we take that for better maintenance of blood sugar for a healthy lifestyle? Dr. Madhura, would you like to take this?
Yeah, there are quite a few supplements which can be taken. But of course, you have to do it in consultation with your doctor as per your age, as per your body type, as per your lifestyle. The doctor will curate it for you. Having said that, it's not a must always. Type 1s, the main problem is there's no insulin. Rest of it, they're pretty much like you and me. So it would be the same like for everybody else. Nothing specific that I would like to say here.
Yeah, so supplements don't play a major role.
Not a major role, yeah. Only supportive.
And one more question is from Aditya, that does it help to stop carbs altogether in type 1 patients?
No, I think that is not a very good idea at all, especially in a child who is growing. Many a times I have seen parents coming with food fads saying, no, now I have put the child on keto diet and abhi bilkul carbs nahi khana hai, roti nahi khayega, chawal nahi khayega. That's not on, because the child has to grow, and to grow your body needs carbohydrates. So I would request any parent who's watching this, please don't follow any food fads. Type 1 can very well be managed with our regular ghar ka khana, and we will tell you how to do it. Don't subject your child to anything unnatural.
Yes, thank you, Dr. Madhura. Yeah, so we have come to the end of our webinar. Trust me, 1 hour just flew by. I didn't realize the time.
True.
And it was a very, very enriching session. Thanks to you, Sahil and Dr. Madhura, for being a part of this webinar. And
and to you, Dr. Preeti, I think for
Absolutely.
wonderfully having it and asking us the correct questions and keeping it alive.
Yes, so I hope the viewers have learned a lot about type 1. I have learned that, I know. So now I'll be more, knowledgeable, I would say, because I have a doctor and a fitness trainer to, support. Okay, fine. Now they've given me some insight, and I hope our viewers too have taken it. So for all of you, thank you for attending this webinar, and be safe and have a good evening. Thank you all. Bye-bye.
Thank you.
Thanks.